Hello, this is Manny Ramos, your host of Rise Up, Real Issues and Stories of Every One of Us podcast. Today on Rise Up, we'll talk about our new PNAA podcast, Rise Up, and we have special guests, Arlyn Dela Pena and Dr. Jamille Nagtalon-Ramos. But first, let me talk about who we are. I'm Manny Ramos, a board member of PNAA and a past president of the Philippine Nurses Association of Central Florida here in Orlando. I'm a professor of nursing at Valencia College in Orlando and an adjunct faculty at William Patterson University. With me today is my co-host, Mindy Ofiana, and our guests for this inaugural episode of Rise Up, Arlyn Dela Pena and Dr. Jamille Nagtalon-Ramos. So, Mindy,
Oh, hi.
how are you, Mindy?
Good afternoon. My name is Mindy Ofiana, and I'm the Legislative Committee Chair of PNAA and the corresponding Secretary of PNAA Foundation. I was a past president of our local chapter here, PNAA Southern California. And prior to my retirement, I served as the Chief Operating Officer and Chief Nursing Officer of one of the medical centers at the KPC Health Systems. Before we begin our conversation, there are some people who may not know what podcast is. To put simply, it is actually another method to entertain, to humor, or educate. It is actually like a television show wherein there's many series that is being done and that it is shown in as episodes.
This publication was made possible by Cooperative Agreement CDC RFA IP 21-2106 from the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services. Its contents are solely the responsibility of the authors and do not necessarily represent the official views of CDC HHS. With us today as our first guest for this inaugural episode of Rise Up is Arlyn Dela Pena, a Filipino-American U.S. Army veteran, a registered nurse, producer, actress, filmmaker, wife, and a mother of twins. Arlyn graduated from the Washington State University with her Bachelor of Science in Nursing and was commissioned as a second lieutenant Army Nurse Corps officer into the United States Army. She worked as a trauma surgical intensive care unit nurse and obtained the National Board Certification for Critical Care Registered Nurse before deployment to Iraq. Arlyn served in the military for almost a decade before transitioning into filmmaking. Arlyn held a leadership position in PhilArm Creative, a nonprofit Filipino-American organization promoting a more culturally integrated and diverse entertainment industry. She was a podcast host and producer for PhilArm Creative Voices and has been a producer, actor, and military consultant on various films and media. Arlyn is based out of Hawaii and Los Angeles. Arlyn, welcome to Rise Up.
Welcome, Arlyn.
Aloha. How are you guys?
Aloha.
I might have some noisy coworkers. I have the twins with me. They're dying to say hello.
No problem.
wow.
No problem. So,
How are Keanu and Aurora?
They are doing wonderful. They're huge now. They are actually turning 6 months tomorrow.
6 months already.
Mhm.
So anyway, Arlyn, why did you become a nurse?
So I became a nurse. It's kind of a family tradition. So my mom was a nurse, all her sisters. I have many cousins, aunties, uncles, and many relatives who are nurses. So I definitely wanted to go into a career that was sustainable to the things I wanted to do with life, which was travel, have a lot of pocket money, and save lives. So I became a nurse.
Oh, yeah. So you were born here in the USA?
Actually, no, I was born in Germany.
Oh, wow.
Was your mom military nurse too?
She was not. So she went to nursing school in the Philippines and then went to Germany. And so she went there in 1970. And then she met my dad, who was a U.S. Soldier. And he was in the army, who was stationed in Germany. And after 6 months of knowing each other, they got married. And
Oh,
then they had
wow.
my sister, and then I came 2.5 years later.
Oh, wow.
Oh, wow.
Oh.
So how is that growing up in the military? I guess you could say in a military family, I guess, right?
Growing up in the military, it was fairly easy because, we didn't really move around a lot. We left Germany when I was about 4 years old, came to California. That was the first state that we came to. And then I started kindergarten in Washington State. And I stayed there from kindergarten until freshman year of high school. We moved to San Antonio, Texas. And so we were in Texas. I started college there, and then I transferred out to Washington State. So it wasn't too bad for me. We didn't have to, move every few years. But I think going into high school is always really hard. But, I mean, my parents, I come from a very strict family. My dad was a drill sergeant and my mom was a nurse. So it's like, it was like this,
Yeah.
So I was very disciplined, growing up. So when I went on my own for college, I had no problems.
Oh,
Yeah.
wow. I betcha. But there must be some challenges that you have faced when you were studying to become a nurse.
Oh, of course. I was doing Army ROTC while I was in college. And so that's one of the 3 different ways that you can commission as an officer in the military. And so, a lot of people just thought, oh, she wears a uniform, she has this class. No, I was up at 6 a.m. doing physical fitness with everybody at, I don't even remember, like 5 a.m. before school started. And, as a college student, you just want to go out, have fun with your friends. But no, I have to get up because I have an inspection, or I have to go to the field over the weekend and sleep with no tents, and survive in the wilderness and play infantry officer, So it was a little challenging in that way because I wanted to really, just kind of be with my friends and enjoy that college experience, which I did. But at the same time, I really had to earn my scholarship doing ROTC and nursing school at the same time because, clinicals too, it starts very early. So
right.
you still have to keep up with your academics and then even your physical fitness. They're always looking at all of those things.
Oh, I see.
So, Arlyn, after graduating from college and earning your license as a nurse, did you immediately go into the Army as a nurse?
I did. So, first things first, you have to pass the NCLEX. And when you do ROTC, if you don't pass the NCLEX, I think it's like by the 2nd or 3rd time, they can actually branch you into anything in the military. So I could end up as infantry or logistics or transportation or military intelligence, anything, right? And so you don't truly become an Army Nurse Corps officer until you pass the NCLEX. So after that, I went to Officer Basic, which was for all of medical branches in the Army. And so I went back home to San Antonio, Texas, and I trained, I think, for almost 3 months. And then after that, I went to my first duty station, which was Washington, D.C., at Walter Reed Army Medical Center.
I see. So, with COVID ongoing lockdown, with our health crisis, can you tell us about your decision to get the COVID vaccine? Was it a hard decision for you to do it?
So I think the early recommendations, because I was pregnant with the twins during the pandemic. And so let's see, I got pregnant in August, and then the recommendations through the American College of Obstetrics and Gynecology, ACOG, it came out, I believe, in November, December, where they started to let people know, the mRNA COVID vaccine is acceptable. It's deemed safe. And for me, with the military, because we're so highly trained with different types of medicine, with whether it's inpatient in the hospital, outpatient if you're in a rural setting, or even tropical medicine when you're out there, wherever, right? So we've been learning about mRNA vaccines for a long time. It was nothing new. And then on top of that, if you're a soldier, you just get in the line and you get vaccinated and you don't even know half the time. But you just say, okay, because if it's for your protection.
Yeah.
And a lot of nursing research actually occurs during deployments or during, the military does a lot of research. So I felt like I was very well versed in that realm. And, the biggest thing for me is because, here I am in second trimester in December, should I get it right away or just wait until third trimester? And because the vaccine rollout didn't really happen until December for out here in Hawaii, it's called kapuna, which are like our senior citizens. They were the first ones, the vulnerable populations. And then, and military, of course, gets the vaccines very early too. So my husband was vaccinated in December. And so I had to kind of wait my turn until my category was eligible. But as soon as I was eligible, I was able to get it. And by then I was 8 months and then 9 months pregnant for the first and second dose. So I'm proud to say that the twins do have antibodies as well for the COVID vaccine.
Yeah.
Wow. That's wonderful.
So, Arlyn, when you got the vaccine, because I know when I got mine, I mean, I had sore arms, I had a slight fever the day after, but after that I was fine. But how was it for you as a pregnant woman when you got it? Were there any side effects?
Okay, so I don't know if God just knows I need an easy life, but I had no symptoms. None.
Oh, wow.
Both times.
Wow.
So the first time I was actually an inpatient because I was having a lot of pre-contractions. And so they were worried that I was going to go into labor. And I don't know if I was just already exhausted from being pregnant with twins or what, but I mean, my arm was sore maybe for maybe half a day, 6 hours, if that. But I literally had no symptoms. And then I went back in before I got induced at 9 months to get my second shot. And again, I was expecting okay, maybe I'll feel really sick or tired or something, and nothing. I was very lucky. I felt very free, but again, I don't know if it's my body is just so overwhelmed with, I'm carrying over 12 pounds of children inside me or what. But, my mom, she did not have any symptoms. She's 70 years old. And then my husband, he said he felt tired, but the next morning he ran 10 miles. So I don't know how tired he really was. But all of us, we ended up getting Pfizer.
Oh,
Okay.
I see. That's good. So you were pregnant and then you delivered. Was there any side effect other than they having the antibodies for the kids? Did they have any symptoms or anything that you are going to be worried about? Because
I don't think so.
Oh, okay.
Yeah, I don't think that they had any issues. I mean, it was kind of a very eventful birth for me. I ended up losing a lot of blood, but the twins came out perfect. Their APGAR scores were both very high. They were super healthy. They were huge for twins. They were both over 6 pounds. And so, and I delivered at 37 weeks and 4 days.
Oh, I see. Right on the normal thing, huh?
This was your first pregnancy, right, Arlyn, and the first babies?
No, they're number 2 and number 3.
Oh, that's
and so we have a
That's right.
7-year-old who's in second grade.
How is he doing?
He was so excited to become kuya, and then he realized he has to share. So he's doing really well now. I think at first he was because he had been praying for this moment for a really long time. And so he was so happy when they were born. But, in his mind, they were going to be, there and he could play with them very easily. He didn't know that, they sleep for a long time. They eat a lot, and sometimes they cry. So, it's just a adjustment for him.
I see. When I was in high school, I wanted to become an actress too. And I am amazed how you are. Yeah, but my mom was not for it. You are going to be a nurse. That's what my mom said. So when you're talking about your mother, I can remember my mom. May she rest in peace. But anyway, how did you transition from being a staff nurse to being an actress?
So I'm kind of I'm like the cat with 9 lives and probably have 3 lives left. My whole life is like a lifetime story. Rodney, I know you know. So basically, when I was on active duty, I decided to take the rest of my vacation days and go to weddings on both sides of the family. And so my husband's cousin was getting married in Mexico. We were supposed to be there for 3 days, then go to San Francisco, meet my family, and then fly back to the Philippines for my cousin's wedding. And I was maid of honor. Unfortunately, on day 2 of Mexico, I was in this freak accident during the reception of the wedding, and a rogue wave took over the beach where the reception was at. It picked up a metal fire pit. It rode the wave, and it hit me and only me. And so my saving grace was that, I had my back to the ocean, which is rule number 1. Never turn your back to the ocean. and so, my husband and I, were a few feet apart. Vincent, who was 2 years old at the time, was playing in front of us on the sand and like climbing onto the dance floor, which is like, sitting on the beach. And the wave came, and I was leaning forward to go get Vincent because the wave submerged him under the water. It went above my husband's waist, and we were at the highest point of the beach. So I leaned forward to try to get him, and then something hit me. And I was like, is that hot or cold? It all happened very quickly. But long story short, no one else got burned. I was the only one who got burned. And so I was flown out of Mexico back to the United States, to San Antonio, Texas, to the burn unit where all my friends work. The irony, I'm a burn trauma ICU nurse. So like I had the most knowledge, when I was there. Anyhow, made it back to San Antonio. I ended up getting cared by all of my peers. Everybody knew me as the girl on fire in Mexico. And so I ended up learning how to, rewalk. It took me 6 months. So I got out of the military a month later after my official end date, just so I can get my care. And my husband and I were moving to Los Angeles because he got picked up for fellowship at UCLA. So to answer your question, the reason why I became an actress was because I could not even be a nurse. And I saw what old age would look like. I had to ask my mom to come back from the family reunion. I had to ask her to come back early right after the wedding because I couldn't even do my own wound care. And at the time, my husband, who was still active duty, was stationed in El Paso, Texas, and I was in Washington State. And so I couldn't drive. I couldn't do my own wound care. I couldn't even watch my own son. So when my husband simply asked me, do you want to be a stay-at-home mom, or, do you want to, go back to the ICU? Or my plan was anesthesia school, actually. Do you want to pursue that? I said, I don't know, and I asked him, if you could be anything, what would you be? And he was like, I would be a surgeon. And I was like, wow, that's boring. So he's already a surgeon. He's a urologist. So, And
So Arlyn, you had a leadership position with Film Am Creative, and when we met in Boston, you and your team were filming Nurse Unseen. Can you tell us a little bit more about this?
Yeah, so Nurse Unseen is a documentary about Filipino nurses during the pandemic. A little secret, I've seen the rough cuts. And I see lots of familiar faces, which is awesome. And I just want to thank Mary Joy, Dia Garcia, and also Carmina Bautista, because without them and being able to connect with them, we would not have had the privilege of filming, the leadership conference in Boston with PNAA in 2021. And that footage is so key to really showing all the different sides of Filipinos and what they've contributed to nursing and it's such an important documentary because nobody has really highlighted Filipino nurses and the contributions. And I think it's about time, especially with the statistic that, at one point at the height of the pandemic, the nurses who have died of COVID, Filipinos made up 31.5%, which is huge. And we only make up 4% of the entire nursing population. And that's about 150,000. And so that's a staggering statistic. And, we started the documentary to answer why. Why are so many Filipino nurses dying? So we look forward to, showcasing it to everybody. We just submitted to a very big film festival. So fingers crossed, everybody pray.
Yay.
I pray daily that we make it in. And so that way, we can really, we hope to get picked up and be distributed to many different outlets and be able to share everything that we've discovered and want to show everybody.
Wow, that's awesome to be able to portray, share to the world the kind of nursing we have as Filipino American nurses. So you are now heavily in the entertainment world. Just yesterday, I saw your film on balancing sacrifice.
You saw it.
Yes, and it's 8 minutes, and it apparently it got to number 4 out of the 10 entries, and you became the best actress. So how are you going to merge this life of acting and family life? To be honest, how are you going to balance that?
Yeah, I've been acting for basically since 2016. That's when I moved to Los Angeles. And, I felt kind of a sense of renewal and just trying to figure out what makes me happy. Because with my husband, he said that he's basically doing everything that makes him happy and he wouldn't want to do anything else. So he asked me, well, what would you do? And I told him, well, I saw what old age is like. Maybe I'll just become an actress. And I wasn't entirely serious about it, but he was like, well, if that makes you happy, then you should absolutely do that. And of course the practical side of me is like, can I make a good living off of that? Can we take that financial hit? And he was like, yeah, we'll figure it out. And so we did. And so to answer your question, balancing between acting, being a mom and a nurse, it's kind of just like working the floor, right? You just have to like kind of triage and figure out what's doable and what's not. And I'm a firm believer, if there's a will, there's a way.
That's right. I see.
Yeah. Well, thank you for putting a focus on Filipino nurses and your work towards promoting a more culturally integrated and diverse entertainment industry. There's got to be an inspiration there, Arlyn, for you pushing these things and moving this agenda for Filipino American community.
Yeah, so growing up, I did not grow up around a lot of Filipinos. Often I was one of 3 in my entire grade of Filipinos. And there was really not even a lot of different diverse cultures that I went to school with. And so, whoops, you okay? He's like looking at me like, yes, I am. Joke's on you. There you go. So the motivation to really push this agenda of highlighting Filipinos and people of color, the Asian community, really stems from the lack of diversity that I had growing up. And, there's a lot of Filipinos, especially in my age or even slightly younger, that they don't really pay attention or they could care less. But, it's so important to be proud that you're Filipino and let everybody know that, Filipinos are very special. We're all, I feel like, artistas deep down inside. We're all trained to sing, dance, and, always have lots of parties and potlucks. And I just feel like that's such a wonderful message to share, because not every community really has that sense. And having this Filipino American culture is very different than growing up in the Philippines, and I have a partly German upbringing too. And so it's just all very different in different sides of the United States and overseas. And I just feel like we have such wonderful stories to tell. We might as well share it and document it and have it live forever.
That's right. Yeah, I'm so proud of what you do and how you transition from a military personnel to being a mother. Nursing personnel as a nurse, right, in military, a mother, and now an actress. So to an end, and we have how many more minutes do we have? A few more minutes. What do you think would be your advice for expectant mothers out there who needs to decide on having vaccination?
So I think for the mothers out there, there's a lot of real research that you should look into. I would definitely talk to your healthcare providers and ask for the specific journals, not just what you read on social media. I think it's important to understand how these vaccines work and make the best decision for you, because not everybody is really eligible for the vaccine. For example, if you have cancer or if you have other like different types of comorbidities and you get pregnant, of course, like there's always a risk. So, talk to your medical team and make a sound decision, because if you're able to help protect your babies, without them having to directly get the vaccine because it's not offered to them yet, we might as well do it. Save the people around you, because I didn't just do it for myself. I did it because our 7-year-old son, he is not able to get vaccinated as of yet. My mom, she has comorbidities. She's older. I want to protect her. And of course, my husband. And so it's truly a way to tell everybody that how much you love them and that you care for them. And we can do it all together if we, look into it and make the right decisions for ourselves.
Well, we thank you very much, Arlyn, for sharing that precious time. I know Aurora there and Kiana are like, hey, look at me too, pay attention. But it's so nice to meet them here. I mean, I do see them in Facebook. But yeah, and hopefully we get to see you again at the next convention. Thank you again for sharing your time with us.
Thank
you so much for having me. And I hope to see you guys in Hawaii soon.
Yes. All right. Bye, Arlyn.
Thank you, Arlyn. Nice meeting you. Nice meeting you.
Bye.
Bye.
And now let me introduce you our second guest of this inaugural episode of Rise Up. Dr. Jamille Nagtalon-Ramos is an assistant professor of nursing at Rutgers University, the State University of New Jersey. Her research interests have been fueled by her clinical expertise in women's health and her cultural roots. As a third-generation nurse, born and raised in the Philippines, she is passionate about exploring the Filipino-American experience and investigating sexual reproductive health disparities. She's the recipient of the Provost Fund for Research Catalyst Grant Award for her research on the sexual and reproductive health of Filipino-American college students. Dr. Nagtalon-Ramos is a board-certified women's health nurse practitioner in postpartum care and well-being, contraception, lactation, and sexual health. In 2018, she was inducted as a fellow of the American Association of Nurse Practitioners for her outstanding contribution in advancing nurse practitioner clinical practice and education. She was recently a Philippine Nurses Association of New Jersey Excellence Awards honoree for Nurse Education of the Year. Dr. Nagtalon-Ramos is an award-winning author of Maternal Newborn Nursing Care, Best Evidence-Based Practices, and has co-authored the Midwifery and Women's Health Nurse Practitioner Certification Review Guide, a vital resource for midwifery and women's health nurse practitioner students and new grads. All her books combined have sold over 12,000 copies worldwide. So as we start this second segment of our inaugural podcast of Rise Up, I'm going to bring up that the CDC has issued its strongest guidance to date against COVID-19. The latest guidance on COVID-19 vaccination is recommended for all people 12 years and older, including people who are pregnant, breastfeeding, trying to get pregnant now, or might become pregnant in the future. The guidance comes as more than 250,000 cases of COVID in pregnant women have been reported, 22,000 of whom were hospitalized. 161 pregnant women died, according to the CDC. Yet, less than a third of pregnant women have been vaccinated. It's well established that pregnancy is also considered an underlying health condition that are at risk for complications of COVID. Overwhelmingly, these complications have occurred in women who were unvaccinated. So welcome, Jamil. How are you?
How are you? Thank you so much for having me. I'm very excited to, have this conversation with you all. And especially in this inaugural podcast, I'm very excited to be part of this.
That's good. So nice to meet you. I've not met you before, Dr. Nagtalon-Ramos, but why did you want to become a nurse?
That's a good question. I teach right now students from, undergrad students, and it's a conversation we have all the time about why did you want to, in fact, their first paper is, why did you want to become a nurse? I actually knew that I wanted to be a healthcare provider. I just didn't know exactly what when I was growing up. My grandma is a nurse. And she actually, Lydia Venzon, she was a dean of a nursing school in the Philippines. When I visited her in 2017, she was in her 90s, and she was attending a nursing conference and presenting at a nursing conference. And I said, Grandma, can we visit you? She was like, nope, I'm at a conference right now. I'm busy. So I have grown up with my grandma, visiting her at Quirino Hospital. She was the head nurse there. And I remember, going before HIPAA, going to her office, and she would bring me to, all the different wards and visit patients. So I feel like it's in my DNA. And same thing with my mother. She's also a nurse. She's still a nurse, actually, at a pediatric ICU at St. Joseph's Hospital in Paterson, New Jersey. And she's hoping to retire next year. She keeps saying that every year, though. So, but I feel like it's in my DNA. And so my freshman year at Rutgers, I decided to become a nurse and, go into nursing. And I knew that was something that, a career that would be very fruitful for me, that I can really help other people. And again, I've grown up in that environment, and I've seen how much my mom and my grandmom have sacrificed to help others. And it was truly inspiring to see that.
So, Dr. Nagtalon-Ramos, what made you go into this field of specialization? I mean, nursing is a wide, field to be in, but why did you decide to specialize for women's health? What made you go choose that field?
Yeah. So I always knew that I wanted to go in a specialty that was helping women. I didn't know exactly what that would be. I knew I wanted to be a healthcare provider. I knew I wanted to help women in the community. And becoming a women's health nurse practitioner combined both of that. And so when I was a senior in college, I did a rotation, my leadership rotation in a women's health, with a women's health provider, one of my mentors at school. And we did home visits for high-risk pregnant patients. And I just said, this is it. This is what I want to do for the rest of my life, is to take care of women, specifically women in pregnancy, women during that early years, I would say. So being able to provide sexual and reproductive health. And it was something that I felt very, something that woke me up in the morning, and really to this day, 20 years in, still very much have the passion to do that.
I see. So with the expertise you have with women's health, and about vaccination hesitancies, so what should pregnant women need to know if they're hesitant to receive it?
It's a good question. I think we need to actually take a step back and acknowledge that women during pregnancy want to do the best for their babies. And they just want to make sure that they have the healthiest of pregnancies, that they're going to have a healthy newborn. And so I think part of that is the hesitance for this vaccine, because a lot of my patients, a lot of my colleagues, or friends and neighbors and other moms who text me and email me or call me up and say, I don't know about this. I can't decide whether or not I should get this vaccine. I feel like, there's a lot of different reasons, right, that we hear. There's not enough research. It's brand new. It was too quick. All these different things that they name that could possibly contribute to their hesitancy getting the vaccine. So how I approach that is I give them the facts. And, as a nurse, right, we do shared decision making. I present you the facts and I will give you the risks versus benefits. I'll give you, what we know about the vaccine, which Manny had said earlier that only a third of pregnant patients, pregnant patients have been vaccinated. That means like most of the pregnant people out there are unvaccinated and they're at a higher risk of getting sick if they have COVID. So they're at a 70% increased risk of death when they have COVID and being pregnant. So those are the facts that I tell my patients. And again, anyone else who, on social media or again, neighbors or mom friends that text me and say, I'm pregnant, or my friend is pregnant, or or my wife is pregnant. What do I do? How do I make a decision getting the vaccine?
I see.
Now, Dr. Nagtalon-Ramos, you're also a lactation consultant. And this podcast, our viewers won't be just nurses. So I'm sure that, their family perhaps and friends would be joining them when they watch this podcast. So for our audience, could you tell us, there will be two questions I have. Could you tell us what is a lactation consultant? And the second question is, for the women who are breastfeeding, should they be worried about getting the COVID vaccine?
Yeah. So I'm a lactation consultant, which means that I'm an IBCLC, an internationally board certified lactation consultant. So I feel very strongly about being able to provide the best services for my patients, and having that knowledge and tools and being certified as a lactation consultant. I wanted to have, that knowledge to be able to provide for my patients, especially being Filipino American. I feel very strongly that as a lactation consultant, as a women's health nurse practitioner, I would be able to provide that service for Filipino American and increase our health, our sexual and reproductive health overall. And that's why, as a researcher, that's my main focus of my research is sexual and reproductive health in Filipino American women. So as a lactation consultant, I'm able to provide breastfeeding support for patients, the patients that I see at the hospital. So I'm actually a hospitalist, which means I primarily work at the hospital. And it's a position that we developed 17 or 18 years ago with an attending physician that I worked with. I was one of the first two in the department. And so we created this position to, primarily manage the care of women in the hospital. And while they're immediately postpartum, they need lactation help. And so I wanted to be able to provide that comprehensive and holistic care for my patient. We do have lactation consultants in the department who are there, most, I think 24/7 now we have coverage. But I still wanted to be able to, when I'm seeing a patient, be able to, take care of them comprehensively, and be able to support them, answer their questions, and be, a better provider that way. With your second question regarding breastfeeding and the COVID vaccine, we definitely, the American College of Obstetricians and Gynecologists, ACOG, that's our professional organization for women's health, they recommend that women who are breastfeeding, again, pregnant, before pregnancy, pregnant, postpartum, breastfeeding women or patients should get the vaccine. We know that there's evidence of being able to provide that antibodies from the vaccine to the baby by getting the vaccine as a pregnant person and through lactation. So there's many different, if someone is not comfortable getting the vaccine during pregnancy, again, we have that conversation again in the postpartum period. So in our hospital at Penn Medicine, we actually offer the COVID vaccine immediately after having the baby during that postpartum period prior to leaving the hospital. So it's just another way of providing that service to the patient. So think about a new mom, right? The new mom just had a baby, if they go home, for them to think about, let me schedule this vaccine, let me make arrangements. Maybe they have other kids for a babysitter, when they, make arrangements for transportation to come back to the hospital. They may not want to bring their infant back to, out in public. So they may be hesitant to bring their infant out to make that, to get a vaccine. So having that service prior to leaving the hospital, it's actually, a really good way to provide the vaccine for postpartum patients. When we give that first dose, we schedule them for the next dose so that it's already scheduled even before they go home. So lots of different, again, points of time that we can do that. And we definitely recommend getting the vaccine during that lactation period.
Ah, I see. So, does vaccine cause fertility problems in women or men?
That's a good question, and a very, very common question that I have heard all over social media. I have heard from many patients who have asked us whether or not it causes infertility. There is no evidence for that. And actually, again, the American College of Obstetricians and Gynecologists, the Society for Maternal Fetal Medicine, those are the premier organizations for women's health, have recommended the vaccine for all women, especially women who are thinking about getting pregnant. There's no evidence that it causes infertility later in life. In fact, my 14-year-old daughter, as soon as she was eligible for the vaccine, I signed her up, we were in line. And when I posted it on Facebook, I got, a flood of messages from other friends, mom friends, and, colleagues, and a lot of people who were asking that question and were concerned about fertility issues in the future. So I said to them, I'm very confident about the recommendation. There's no evidence that the vaccine causes infertility.
Oh, good to know.
So, Dr. Nagtalon-Ramos, for the patients that you have seen, what is the atmosphere there, and what has been, especially to those for those who haven't received the vaccine? How are they receiving this when you talk to them about getting a vaccine? How has that experience been?
Yeah. So it's interesting because we test all our patients coming into the hospital for COVID. We do a COVID test on all our patients coming in. And so I actually have had a group of patients, right, that are asymptomatic. They come into the hospital, they're just thinking they're pregnant, they're going to have a baby, and then they're in and out, have their baby in and out of the hospital. But then they test positive and they're completely surprised. And, they're like, wait, I don't have symptoms. How can I have COVID? Right. And so I have the conversation with them actually. And I say to them, I remember this one patient that said, I don't understand. My whole family is so surprised that when I told them I'm positive, when I came in the hospital, they tested me and I was positive. And she said, my whole family was so surprised because I isolated myself for, the last, month of pregnancy. And I isolated myself. I didn't go anywhere. And so I'm surprised that I have COVID. And I said to her, okay, so did you have a baby shower? And she said, yeah, I had a baby shower at my house, right? And I said, okay, so did did you have visitors come to your house for your baby shower? And she said, yeah, of course, it's a baby shower. And so, I think sometimes we do take precautions, but we're not thinking, in a bigger way, right? Of, okay, so she didn't have a grand baby shower at some restaurant, but then she had a baby shower at home, and then all these people came over and possibly exposed her to COVID. Nice. So, having that conversation and taking that opportunity with our patient, with that particular patient, and saying, okay, so you're thinking about that, right? Exposure could happen at any point in time. So when people want to visit your baby at the, at home, yes, you're not bringing your baby outside in the public, but think about also the people that could possibly be visiting your baby at home. And, and protecting yourself and your baby, especially that first month, right? When the baby's that immunity is not completely well formed yet. You want to protect your infant as much as possible. So you don't want to expose the infant in public and crowded spaces. And also thinking about, again, that balance of mental health, so if they live in a place where they could go outside, perhaps, walk around the block if it's, it's a safe community and it's not crowded, or maybe go to a park and away from people wearing masks. They can still possibly do that, but going to a birthday party, right? We're Filipinos. So I know in my family, my husband has 38 first cousins. So we have there's a party every weekend, it used to be before COVID, right?
Yeah.
And so I'm still very cautious in different ways, in terms of, being able to attend those parties or attend gatherings with family members. And actually saying, my healthcare provider told me that I should be protective of my family. And in our community, we're a very collectivistic community, right? We want to be able to say like, pakikisama, right? Like you want to be like, yes, of course I'm going to be there, right? But actually saying like, because of COVID, I can't bring my baby, or I can't be there because I don't want to expose myself. I have a newborn. Yeah.
I want to go back to the conversation related to your lactation nurse, and for women who decides to breastfeed when they leave the hospital. What is your success rate in making sure that they get their COVID vaccine?
Oh, at the hospital, you know what? I don't have those numbers at my particular hospital. I don't remember. Yeah, I don't remember recently what our numbers are. But we do offer it. So it's part of our discharge in different levels. So the provider, the medical team, the residents and attendings, and then the nurse practitioners and the physician assistants, when we see our patients, even at admission, when they come to the hospital, we test them for COVID, and then we also we say to them that vaccine is offered for you before you go home. And then the nurses also, during their discharge teaching, talk about having the COVID vaccine available for them. So it's actually a really cool process that, we've developed in the last month or so, I believe. So I don't know if we have numbers yet, because it's fairly new service that we provided in our hospital. So it's kind of neat, though, that it's something that, again, we were one of the first units in the hospital that were able to offer that before discharge.
I know. I just tried to remember when without the COVID yet, when I was a CNO, we were having a hard time convincing mothers to breastfeed. So I just wanted to see how the correlation of now it's COVID, how are they going to get their vaccines? Anyway.
So, Dr. Nagtalon-Ramos, what do we know of those pregnant women who have become infected with COVID? I've heard some have ended up in ICUs. How is that situation?
Yeah. So, if you are pregnant and you get COVID, during pregnancy. You have a higher risk for preterm delivery. There's a higher risk for admission to the NICU of your newborn. There's an increased infant mortality, and disease may be more severe. So it's not just you that may be affected, but your baby might be admitted to the NICU for a longer period of time. Again, mortality and morbidity is higher. There's a twofold increased risk of being admitted to an ICU if you are pregnant with COVID. So thinking, the medical part alone is already distressing, but thinking about, again, we're nurses, right? So we think about the holistic approach, how that affects mother-baby bonding, right? So if someone is severely sick with COVID, that baby may not be able to visit mom. And thinking about, again, logistics. So usually our nursery is in a different part of the hospital than the ICU. And then thinking also about the team and how that affects the team. So a nurse will be assigned to the mom who has COVID, but then, we have to coordinate having the baby visit mom, if that is even possible. And then having a support person, who's that support person, and who will they be able to visit baby and visit mom because it's a COVID unit. There's lots of logistics involved. When you think about the real nuances of having a mom with COVID in the ICU, or even having a mom who has COVID and is really sick in a postpartum unit. There's a lot of stressors that happen for the family unit, and also the nurses taking care of them. We want to make sure we're taking really good care of our patients, but we think about the pregnant or postpartum patient and the baby as a dyad. Because if a mom is obese or has asthma, has diabetes, they're an even more risk for disease when they have COVID and they're pregnant. So someone who may not be at a high risk, of getting COVID, but once they are pregnant and they have COVID, they're in a different level of risk. So, just a healthy adult getting COVID may not be as high of a risk in terms of morbidity and mortality, but once you're pregnant, you're in a different level.
I see.
Wow.
My next question to you, Dr. Nagtalon-Ramos, is more not granular as it relates to women's health, but it's more of a 40,000 feet about research. So I just want to ask you about implementation of research into practice. Did you have any challenges or opportunities with that process?
So not related to COVID, but currently we have this really neat program, texting program that we have, that one of my colleagues, Dr. Adi Hirschberg, had done the research a few years back. We were seeing that we had a lot of patients who were not returning for their postpartum follow-up visit. So, which means after they have their baby, they go home, and we want them to follow up in 4 to 6 weeks, especially those who have blood pressure issues. And we have many patients who have blood pressure issues, whether it's chronic hypertension or gestational hypertension. So she did this research on doing a texting program, which means instead of a patient coming back to us, again, when we talked about someone who's going home and having them come back, thinking about logistics, newborn baby, other kids at home, access to coming back. She did the research in giving them a blood pressure cuff to take their own blood pressures at home and texting us the results. And it goes into this computer in the system, and it tracks all their blood pressures. If there's any blood pressure that was concerning, they get followed up. And so it's kind of neat, thinking about innovation and how our patients are very savvy with texting and using that as a tool. backed by evidence to have them follow up that way. And also giving the patients their own agency to be able to track their own health, right? Take their own blood pressures, and be part of that. It's not, instead of just a passive passenger, I guess, of their health, but instead they're active members of that whole, system and unit.
I see. There you go.
Well, we thank you for your time and expertise, Dr. Nagtalon-Ramos. I'm sure, those were the most frequent questions that we've been getting about the COVID vaccine, especially in that population of women. So thank you. I hope and I'm sure that with the discussions we had today, we were able to clear up a lot of those questions that they had. And the hope is that, we could reduce that hesitancy to get that vaccine and make sure that they will be healthy. So thank you. And that is all that we have for this episode. I want to thank our guests, Dr. Jamille Nagtalon-Ramos and Arlyn Dela Pena, and my co-host, Mindy Ofiana, our director and producer, Rodney Cajudo, and our executive producers, PNAA President, Dr. Maria Garcia-Dia, and our PNAA Executive Director, Carmina Bautista. Join us every Wednesday here on Rise Up. Until then, keep on rising. See you next week.